I'm going to invite some honorees and Jamie Belcito to join me up on the stage. We are really honored to be recognizing two people, or two entities, I should say, as Maternal Mental Health Heroes for 2025. And this is the first year that we are recognizing a policymaker as a hero, and hope to have two categories just like this year in future years. I'm going to first take some time to acknowledge and recognize a governor who's doing incredible work in maternal health more broadly. But before I do that, I wanted to first acknowledge our policy fellows. We have a few in the room. Kelsey, raise your hand. Anyone else? A policy fellow? Yes, we've got more. Thank you. Government agencies and nonprofit policy fellows. We actually had our policy fellows from the government program in Iowa call to our attention the great work that's happening because of the governor's commitment to maternal health, and then also now maternal mental health. I wanted to say that she is the first governor, Kim Reynolds, to focus on maternal health payments, which we talked about earlier, right? And understand just how critical that is for women and for providers to be made whole. And she is being recognized, as I said earlier, as a 2025 Maternal Mental Health Hero. Here's her statement from their office. I'm honored to receive this award as a Maternal Mental Health Hero for the groundbreaking work we are doing in Iowa to improve maternity care. We are raising Medicaid maternal health payment rates. You can clap for that. Bringing more doctors to Iowa through payment. You can clap for that. And doubling our investment in loan repayment programs to ensure healthcare access for Iowa's mothers. So thank you, Governor Reynolds and your team, and also our policy fellows for implementing the great work that Governor Reynolds is prioritizing. We now are honored to recognize the Perigee Fund. You've heard me mention their name earlier. We were talking about how much more awareness there's been in the field of maternal mental health. And with me to acknowledge the Perigee Fund is Jamie Belcito, a colleague. And why don't you two come on up, Tamar and Marcy. And I also want to acknowledge, I think watching today is Elizabeth and Becca and principals, just for your investment and recognition of maternal mental health. Before we give you your award, Jamie has a few things to say, and come on over, Jamie.
This really is like camp in many ways when I come to these forums. It's amazing. You get to see your sisters and efforts around maternal health and maternal mental health, and I feel that way here today. I'm very thankful, Joy, for having me say thank you. I was saying to Joy, in many ways I feel as if we're in my own journey of 10 years into this. I feel like we're at the back of the line again, and I started this journey with Tamar just the other day, or 10 years ago. It feels like a minute, and yet we are here today talking about so much. And Joy, you've done even more work around this. And I would say, had it not been for Perigee, me standing here on behalf of the Maternal Mental Health Leadership Alliance, and Joy, and the work done with Tamar, we wouldn't exist. And that is the truth of the matter. And we've been able to put forth an incredible, in partnership with UMass Chan, an incredible state telepsychiatry model that is currently funded 13 states and 1 county, and there's 28 of them across the United States. And the 1833 MMH Maternal Mental Health Hotline, our executive director, Adrian Griffin, was instrumental in that, and that has served almost 60,000 families, friends across the United States, and it's garnered $86.5 million in grant money through the federal government. And we would not be able to stand here and say any of this if it wasn't for you. Never in our lifetime, though, has the need to lean in to national dialogue on maternal mental health been greater. And I will say again, had it not been for your support to allow this conversation around positive policy outcomes addressing maternal mental health to flourish, we would not have all the wins or the folks that we have here talking about all the things that need to happen. I'm in favor of Canada coming into the United States and us just taking over the whole maternal health portfolio and driving it down there. That is a bad joke. But trying to bring some levity. And I did want to ask Greg, thank you, Greg, was the narcissism trial that you did, was that at 1600 Pennsylvania Avenue? That was another bad joke that I had. But I'll be on stage later at 6. So Joy, thank you so much. And thank you to Perigee. We wouldn't be here without you.
One final statement about the investments from Perigee that has supported the work that Jamie talked about, also the military, the Moms Act that passed in the not the omnibus, the NDAA, the National Defense Authorization Act. Thank you. These things were possible because of your investment. We also, of course, were honored to launch and pass the legislation that formed the Federal Maternal Mental Health Task Force that issued the first federal strategic plan. Recommendations may or may not go to governors, but we'll make sure they still do. Just remarkable work that would not be happening. We wouldn't be here today without Perigee's investment, and we just want to say thank you.
Right.
Yep. Yep.
All right. Thank you so much.
Thank you. Well, I just want to say on behalf of Perigee Fund, Tamar and I want to thank the Policy Center for Maternal Mental Health for this tremendous honor. Our Executive Director, Becca Graves, and Director of Programs, Elizabeth Krause, who many of you know, are here in spirit and send their immense gratitude and asked us to share a few reflections with you. So Perigee is a national philanthropic organization focused on prenatal to 3 mental health. On our small team, we have a clinician, a storyteller, several policy wonks, people who have directly served families, and people with lived experience. We approach our work in ways that recognize that mental health of children starts early. By early, we mean early, in the infant and toddler years. As Bessel van der Kolk, author of The Body Keeps the Score, said, the parent-child connection is the most important, powerful mental health intervention known to mankind. But in order to realize the mental health well-being of our children, it's necessary to start with the mental health of mothers, including in pregnancy and the perinatal period. We've spoken about that many times today. As a philanthropic funder, standing here to receive this award feels very humbling. The true mental health heroes are the advocates, the practitioners, and the researchers that we fund, all of you in this room and online today, to transform the shockingly under-resourced issue for families. 5 years ago, when we were thinking about making our first grants in the National Maternal Mental Health Policy and Advocacy, we asked ourselves 3 questions. Whose job is it to think about maternal and mental health 40 hours a week, 12 months a year in and year out? Who, like us, saw maternal mental health as a policy, systems, and equity issue? What capacities did maternal mental health advocacy organizations need to be as effective as possible? With all of you in the room and online, we've accomplished significant strides in moving maternal mental health up on the priority list with increased visibility and growing public investment federally and in states. And behind the scenes, Perigee has collaborated with peers to increase philanthropic investment in maternal and mental health. We're proud of these accomplishments, yet we're still dissatisfied. Despite our progress, the dollars going to the most common complication of pregnancy remain decimal dust, far from what's needed to truly support families. And we know that for every 2 steps forward, there is often 1 step back. On the hard days, At Perigee, we're grounded in the knowledge that maternal mental health ecosystem is well equipped with effective prevention models, clinicians, tools, policies, and leaders like all of you. When we're successful, our efforts make a huge difference for families and reverberate across generations. It's up to all of us, including our policymakers, to ensure that families succeed. We must act now to heal intergenerational trauma through the power of early relationships in every single state and community, starting with maternal mental health. So thank you.
Congratulations. I'm going to ask those in the audience to stand up for these amazing people who have changed our lives, really changed our lives and our ability to effectuate change. Thank you. Thank you. You can take this.